True or false, rhinoplasty addition?
Rhinoplasty can improve breathing problems.
Yes, it can. If there's any physical obstruction, then a septoplasty and internal surgery at the same time can improve those breathing issues. However, allergy issues will not be fixed by surgery.
Results from rhinoplasty appear instantly.
False. You will see an improvement immediately, but there will be a lot of swelling. The result gets better and better over time. You will have most of the result at 3 months. Full result takes 1 full year.
Rhinoplasty does not necessarily involve breaking the bone.
True. In many cases, we do break the bones to move it, but if the bony part of the nose is nice and we don't need to change it and we're only operating in the lower part, we don't need to break these bones.
You can combine rhinoplasty with other procedures.
True. Two of the most common things we do with the rhinoplasty is the chin implant to give the face some balance, or fat grafting to the under eye if the cheeks are hollow.
Only external incisions are used in rhinoplasty.
False. Most of the incision is inside the nose. And then the only external incision is across the columella, which is very, very hard to see. So most of the incisions actually inside the nose.
The shape of your nose affects how you breathe.
True, to some extent. Obviously, there's a deviation on the inside that causes a deviation on the outside. So if you're correcting the deviation, and it's always best to correct the shape at the same time. Trying to correct the shape later in the second surgery is much, much harder.
Everyone's recovery time is the same after rhinoplasty.
False. Some people recover faster, some people take a little bit longer. Everyone's going to reach the same endpoint, but their journey might be a little bit different.
Swelling after rhinoplasty lasts forever.
False. The swelling, a lot of it goes down in 1 month. Most of it, you could say 75% of it goes down in 3 months. 100% of it goes down in approximately a year. It does not stay your entire lifetime.
Rhinoplasty does not change the way your voice sounds.
True. Mostly true. In some cases, if the airflow is better, you might sound a little bit different, but in the majority of patients, the voice production is inside your throat. This does not affect that.
Revision rhinoplasty is uncommon.
Kind of true. Revision rhinoplasty isn't very common, but it does happen. Remember, surgery isn't just about what happens in the nose, it's also about the recovery afterwards. So every surgeon has revision rates. We personally revise 1 out of every 100 noses, and usually it's a small touch-up.
Rhinoplasty results should look natural and not operated.
Absolutely true. The way I look at it is your close friends and family members should be able to make out a difference. Someone seeing you for the first time shouldn't suspect you've had a rhinoplasty done. That is my philosophy.
All rhinoplasty procedures are done under general anesthesia.
False. Most of them are, but if it's a minor procedure, particularly not involving the bones, involving the lower part, that can be done under local anesthesia as well. Do like, share and subscribe.